you could talk to them now about what the latest research says, which is that medications aren't really that effective for chronic pain. So they only work in about 1/3 of patients, and they only reduce the pain by about 30%. So now what they're saying is you need more of a multimodal approach, because they think chronic pain is more due to changes in the brain, so the neuroplasticity of the brain, and that we need to retrain the brain to think differently about pain. So there's lots of other options for your patients, including psychotherapies, physiotherapy, other non-pharmacological approaches, so heat, TENS, all those types of things. And then there's non-opioid medications, so your anti-inflammatories, your paracetamols, your even things like turmeric are showing more evidence for them. So there's lots of other alternatives to consider rather than just your opioid medications. So the first thing to do is have a conversation with your patients, and remember, it's a difficult thing, so it's not something that they might be open to discussing or willing to admit, so don't force the issue, but make sure you have a conversation with them. Ask them about their use, about what they're using it for, how it might be affecting their lives. Do they think it might be affecting their lives? Do they feel that their use has gotten unmanageable? So have a non-judgmental conversation with your patients. Remember to be empathetic. Remember to validate that they actually may have pain, but they may also have a dependence problem. Remember that they may not want to admit that they've had a dependence problem, and it's important not to try and force them to admit that. Talk to them using I statements rather than you accusatory statements. So as your pharmacist, I am concerned about your pain, rather than you're using too much codeine. I can't sell you this medication, but I am more than happy to help you with other things for your pain. Remember to focus on the behaviour rather than the person. So your opioid use rather than you are using too much codeine.